the channel in YouTube is It TV. Really feel happy to meet you all YouTube online today. You can have live chat in YouTube channel. In my channel, Cardiac Center. Today, the topic is very important. Hypertension. Globally, 50% of the people above 40 years, above 42 at any age, 50% of the people are affected by hypertension. Hypertension means increased diastolic and systolic pressure of the artery. That is called arterial systemic hypertension. The hypertension is a simple disease. This will not give any complaints, at least for 5 years. What happens if we don't treat the hypertension? If we don't bring the blood pressure under desirable level, that will damage the brain, heart, kidney. It's a very important. Initially, hypertension, as I said before, the patient may not feel any complaint except simple lightheadedness or simple shortness of breath. So the prevalence is very high globally. And moreover, this hypertension, if we take care of it in the early stage, if we take medicine, proper advice regarding diet, exercise, and periodical evaluation, will reduce morbidity and mortality significantly. Lot of minor stroke to major stroke happens due to uncontrolled hypertension. Okay, let's see. How is that hypertension nowadays we treat comfortably? First we see from young age to elderly age. In youngster population, diastolic hypertension is very common, particularly the low level blood pressure, lower level blood pressure is called diastolic blood pressure. At any age, the blood pressure should be below 120 mm mercury and 80 mm mercury. At any age, after 20 years. Our target, a doctor treat the patient keeping the target in the mind below 120 and 80. Usually, general physicians and cardiologists, they treat hypertension. Based on new guidelines, every year we get evidence-based new guidelines to treat hypertension. The numbers, mercury level, whether should be treated or can be postponed, is based on the risk factors of a particular patient. Especially youngsters, those who are having little elevated blood pressure. For example, 130 systole and 90 diastole. We don't need to give medications immediately. we can advise a patient to try lifestyle modifications, dietary modifications, and regular exercises. Suppose if they have 140 or 100, any youngsters, even that case also, not necessary to start medications immediately. We give the time, we can evaluate the patient properly with the basic cardiac evaluation, especially electrocardiogram, echocardiogram, lipid profile, renal function test, uric acid, electrolytes, and thyroid profile. These are all the important investigations for every patient coming with hypertension. First, lifestyle changes are very important. According to the new guidelines, we have the new guidelines. We have the new guidelines. A patient blood pressure goal should be less than 120 and 80. Lot of new guidelines are coming to keep the blood pressure at a desired level. But whatever the guidelines says, it may be from European Society of Cardiology, European Hypertension Society, American College of Cardiology, American Hypertension Society, and other individual countries. All the countries, they have their own hypertension guidelines. But universally accepted level of blood pressure is less than 120 and 80 millimeter mercury. What happened? First we see what happened if we don't treat hypertension. First, for example, assume that the patient is having 150 and 160 blood pressure. They may not have any complaint, but we can leave the patient. What happened by the time, even after 2 years, 3 years, 4 years, 5 years? Patient may develop mild stroke. Mild stroke in the sense, minor ischemic strokes are very common with untreated blood pressure, which is less than 160, 150. At the same time, if the blood pressure is more than 180, 200, if it is untreated, those type of patient suddenly may develop hemorrhagic stroke, aortic dissection, heart failure, and kidney failure. These are all very emergent related life-threatening complication occurs in untreated, accelerated, uncontrolled hypertension. So the simple management, effective management of hypertension will save your life. Okay, let's see what type of dietary management. Nowadays people are really confused about what type of diet they have to take, whether non-vegetarian or vegetarian. What type of diet? No need to get confused. Very simple diet. This diet anyone can follow. The diet we prescribe diet to every individual based on their comorbid conditions. If they have diabetes, if they have chronic kidney disease, if they have any liver disease, if they are recovering from cancer disease, we prescribe diet based on their comorbid conditions. Generally, if we speak, two main diets are very important, universally accepted, universally hundreds and hundreds randomized trials shown significant improvement with these two diets. Diet number one is Mediterranean diet. What is Mediterranean diet? Mediterranean diet means taking vegetables daily 3 to 4 times. How is it possible, you can ask? Very simple. Take vegetables in the morning with the breakfast. Even with the lunch, you can take boiled vegetables. Even at dinner, you can take any like salads with the vegetables. This is the way to take. Those who are taking rice, Asian population, their habit of taking rice is very common. Those who are taking rice, they can restrict the quantity of rice. Instead of rice, they can consume more vegetables and restrict the quantity of rice. The same way, those who are taking the habit of wheat products, particularly bread and chapatis. Bread means you can take only brown bread instead of white bread. Rice, you can take brown rice instead of white rice. So the carbohydrate you can take daily 1 or 2 times with a less quantity. The total 24 hours intaking the percentage of carbohydrate should be less than 30%. 50 to 60% should be vegetables and sprouts. Grains means whole grain you can take. Ragi, millet, etc. This type of the whole grains are having more fiber and vitamins. That gives satiety. So whole grains daily 3 to 4 servings. Fruits, that's a very important in the Mediterranean diet. You can take fruits daily 3 to 4 servings. Okay, economically if you are poor, you can take daily minimum 2 times, or if not possible, daily 1 time you can take fruits. Particularly, any seasonal fruits you can take, provided if they don't have kidney stone or renal failure. Any seasonal fruits are acceptable, but safely apple, papaya, pomegranates, cherries, strawberries, plum, and fig. This type of fruits they can take. But if they are diabetes, they have to avoid certain fruits. That's a very important. If they have kidney disease, they have to avoid certain fruits. That's a very important. Based on your personal physician, the fruits can be consumed 3 to 4 servings daily. Nuts, any nuts, groundnuts, walnuts, badam, pista. This should be taken weekly twice or thrice. The quantity should be less than 100 gram. That's a very important. Every serving of nuts should be restricted with 100 gram only. So nuts should be taken weekly twice or thrice, not daily. Okay, let us go for the meat. How can you eat meat? Generally, trans fat meats should be avoided, especially red meat. we have to avoid for the sake of your well-beingness. Okay, if it is unavoidable based on your tradition and culture, restrict the meat with a minimum quantity. White meat preferable in case of red meat. In order to get the best fitness, white meat will have little benefit on protein substance, especially chicken, fish, egg. You can take white meat. Okay, what about the oil? The oil should be daily 1 or 2 to 3 spoons per day. Tablespoons. Teaspoons, not tablespoons, teaspoons. 2 to 3 servings per day, not more than that. Cheese, in case of butter, cheese will have more beneficial effect than butter or ghee. Consuming cheese weekly, 3 to 4 servings, less than 25 gram is acceptable for everybody. More than that, that will alter the body metabolism and lipid metabolism. And then very important point, salt. Salt is very important. You cannot escape the hypertension. You cannot escape from the good hypertension control with the salt. The salt restriction is very important. Everyone should have less than 2.5 gram per day, irrespective of your age or other comorbid conditions. If you have stage 3 kidney failure or stage 3 and 4 kidney failure, you have to avoid salt completely. Those who are having stage 1 and 2 kidney failure, they can take salt less than 2 gram per day. That's a very important. In addition to that, they have to avoid salted food. Salted food means commercially available chats, mixes, and routine snacks, particularly potato chips. So those type of highly salted rich food should be restricted, should be avoided if possible. That's a very important. Okay, exercise. What is the role of exercise? Is there any importance of exercise in the management of hypertension? Yes, definitely. The salt restriction exercise will reduce, daily aggressive exercise will reduce the blood pressure 5 to 8 millimeter mercury comfortably. This is very important. Assume that if you are first a hypertensive patient, if your hypertension is 80 or 90, 130, 40, you can try all these lifestyle changes. You can do aggressive exercise. Aggressive exercise means regularly walking for 45 minutes to 60 minutes, simple aerobic exercises, and meditation, pranayama, swimming, simple jogging. Aggressive exercise in the sense, this is the exercise, and doing more aggressive, because immediately to get rid of hypertension, if you start exercise aggressively, like playing shuttles or playing badminton, volleyball continuously, or cricket for more than 2 hours, 3 hours, aggressiveness, definitely the high stress induced exercise can have heart attack. That's a very important. Always the exercise you have to start mild moderate level. Then if you are completely fit, if you don't get any complaint after this moderate level exercise, you can try the aggressive exercise stage. That's a very important. So aggressive exercise will reduce the blood pressure 8 to 10 millimeter mercury, between 5 to 10 millimeter mercury. Okay, what about the weight reduction? Weight reduction also very important. Overweight obesity means that we induce the body inflammatory changes. Inflammation, the basically cellular level inflammation is the main cause for all the diseases, particularly hypertension, diabetes, heart disease, kidney failure, and brain stroke. So all these diseases start from the inflammation at the molecular level, basic endothelial cell level. So the inflammation is a root cause for all the vascular diseases. So inflammation, obesity will have 100% inflammatory changes in the endothelial cells. So reducing your weight, keeping your weight under control will have significant benefits in your healthy lifestyle. Always keep your body mass index below 23. That's very important. Always keep an eye on your weight. Periodically check your weight and try to keep under the desirable BMI level. It's very important. So far we have seen what is hypertension, dietary changes, Mediterranean diet, exercise, food style, weight reduction, lifestyle changes. Then one more point, DASH diet. Before I say Mediterranean diet and DASH diet. DASH diet means it's almost same like Mediterranean diet. DASH means dietary approach to stop hypertension. That is called DASH diet. So what we have discussed, that abbreviation gives the elaborate meaning of hypertension. So we have to stop the hypertension by dietary approaches. That's very important. So your body vascular status, internal organ status, what you are eating, that's very important. That reflects your well-beingness of your heart, kidney, brain function, and fitness. That reflects your diet, what you are taking. So that is the meaning of a dietary approach to stop hypertension. We can stop hypertension even though it is a chronic disease, even though it is a serious vascular disease. You can stop at any stage. If you are really aggressive, you need to be aggressive in controlling your hypertension and stopping your hypertension. Simply you can postpone the hypertension at any stage. You can postpone. If you want to postpone your hypertension for the next 5 years and 10 years, it's possible. Only thing, you need proper changes. You need to be aggressive. You need to have the patience of getting rid of hypertension. You need to do a lot of works, health works for yourself. So DASH diet means the same. Daily 4 or 5 servings of vegetables, 4 to 5 servings of fruits, daily 2 to 3 servings of nuts weekly, daily 2 to 3 teaspoon of vegetable oil, any oil, but if you are using preferably olive oil, that's good. That has rich of omega-3 fatty acids. But some recent studies are telling that there is no use of vascular or cardiovascular benefit of omega-3 fatty acids. Okay, that is different thing, maybe expert opinion, but we have other benefit of omega-3 fatty acids that reduces free radicals in the blood. Free radicals are the main source for atherosclerosis formation and endothelial cell injury. So omega-3 fatty acids will reduce the free radical molecule in the body, oxidized molecule in the body. So oil-wise, salt restriction should be less than 2.5 gram per day. Every healthy individual can consume, not more than that. For 24 hours I am telling. salt restriction. So the DASH diet. Okay, let us come to the point medications. However, after taking care of all this, after following all these lifestyle changes, dietary modifications, regular exercise, the blood pressure is not controlled. For example, if it is persistently 150, 160, we can start very low dose antihypertensive drugs. That's a very important. As I said before, even despite following all the strict lifestyle changes, and if you don't want to medications, and if the blood pressures continue to perpetually at 160, 170, irrespective of lifestyle changes, you have to take medications. That's a very important. If the blood pressure is not coming down with lifestyle changes and diet, you have to start medications. Medications play a very important role that reduces morbidity and mortality. Morbidity in the sense unnecessary other diseases, sudden cardiac death, and a massive brain hemorrhagic stroke, kidney failure, aortic dissection can be prevented by taking regular medications. And we can adjust the medications, we can titrate the doses, and we can lower the doses based on regular follow-up. How you are responding to hypertensive drugs. But whatever it is, suppose, what is the target for people? So, okay, after taking the medications, if your blood pressure is still 150/90, so we can increase the particular dose, or we can add second drugs. Okay, even after the second drug, the blood pressure is not coming under control, we can add third drug. Even there is no reduction of blood pressure, fourth drug, under the supervision of physician or cardiologist, we can add fourth drug. Suppose if the fourth drug is not sufficient, you can add fifth drugs. The fifth drug is not controlling adequately, sixth drug. The sixth drug is not controlling adequately, seventh drug. So ultimately, 90% there won't be a side effect with hypertensive drugs. So everybody should understand they have the wrong perception of taking the number of drugs for the hypertension. They think the hypertension is a single disease. Taking more number of drugs, is it important? Is it necessary? Yes, it is important. It is necessary to take any number of drugs under the specialist guidance, under the expert guidance, very important. They know the side effect. They know when to add, when to remove the drugs from your prescription. So no need to worry about the hypertension drugs side effects. That's very important because physicians and expert cardiologists, they know the side effect of all the hypertensive drugs. What type of hypertensive drugs we have? So before going to the different drugs, we see diabetic patients, kidney failure patients with the hypertension. Their hypertension is perpetually accelerated or going up, it should be brought down immediately in the sense gradually. For kidney failure patient with the hypertension drugs, their blood pressure should be less than 80 and 120. That's a very important. Okay, diabetes patient, if they are diabetes, we can keep their blood pressure less than 130 and 90. And for diabetic patient, that much 120 and 80 aggressive control may not be necessary. Those who are having previous history of stroke, previous history of hemorrhagic stroke or ischemic stroke, We can keep their blood pressure under 130 and 90. That's a very important. Only for kidney failure patient, we have to keep their blood pressure under 120 and 90. And the rest of the people, those who are hypertensive, they have to keep their blood pressure less than 130 and 90. That's a very important. Suppose the newly detected hypertensive patient, if they don't have any diabetes or previous history of stroke, kidney failure, we can try to bring them under aggressive lifestyle changes under Mediterranean and DASH diet. Definitely, that will give promising results without medications. Okay. What type of medications we have nowadays? Nowadays we have very less side effects, maybe hypertensive drugs, and 100% proven by hundreds and hundreds of randomized trials. Hypertensive drugs reduces mortality and it reduces morbidity. That's a very important. Particularly beta blockers. Beta blockers, we have selective beta blockers and non-selective beta blockers. Selective beta blockers, particularly atenolol, metoprolol, like that. And vasodilating beta blockers, carvedilol, nebivolol. Selective beta blockers can be used as a first-line drug in younger population. Younger people, as I said before, initially during this live, younger population will have diastolic hypertension. And elderly people, when the age grows, they develop isolated systolic hypertension. Isolated systolic hypertension, so very dangerous, that will have congestive heart failure. That may lead to congestive heart failure, ischemic stroke, hemorrhagic stroke, aortic dissection, and kidney failure. Diastolic heart failure. Suppose if the systolic pressure is 130 or 120, if the diastole is more than 100, 120, in future it may have left atrial enlargement, left ventricular hypertrophy, and finally it may lead to right heart failure. That is called dry heart failure. We have two types of heart failure, wet and dry. Diastolic heart failure most of the time will have dry heart failure. You cannot diagnose the heart failure by crepitations. The lungs will be very much clear with the auscultation. So diastole is very important. In regularly we see the youngsters, those who are coming with the hypertension, we see the increased heart rate. So the important thing before prescribing the beta blockers, a physician, they need to keep in mind their heart rate should be more than 70. Safely we can prescribe beta blockers. If the heart rate is less than 60, don't prescribe beta blocker, atenolol, metoprolol. That's very important. Beta blockers, particularly vasodilating beta blockers, non-selective beta blockers, carvedilol, can be safely given to heart failure patients. You can start the dose with 3.125 milligram initially, then gradually you can titrate the carvedilol into 6.25, 12.5 and 24 BD. That's very important. So, as I said before, the side effects of beta blocker, bradycardia, atrioventricular block, those cases you should not prescribe selective or non-selective vasodilating beta blockers. It's very important. You have to avoid, the patient should not take their heart rate is below 60, they should not take beta blockers or vasodilating beta blockers. And atrioventricular block, they should not be prescribed beta blockers. The next, calcium channel blockers. We have new generation calcium blocker from nifedipine, the old generation, the early generation beta blockers, nifedipine, nimodipine. Then after that, amlodipine, second generation. Third generation, cilnidipine. Then fourth generation, benidipine. Very common side effects of calcium channel blockers are leg swelling, pedal edema. It's a very common. There's a higher prevalence with the earlier first stage calcium channel blocker. Then next level, second generation calcium channel blocker. Then third generation and fourth generation. If you take amlodipine will have 35% of leg swelling, pedal edema. In case of cilnidipine, it will have 20% leg swelling. And benidipine, we have 10% complication. Complication in the sense side effects that will not have any complication. Less than 10% leg swelling or pedal edema is very common with the calcium channel blockers. And the important point in taking calcium blocker, those who are having congestive heart failure, they should not take any type of calcium channel blockers. Very important. Because calcium channel blockers are having negative inotropic effects. That's the reason those who are having impaired left ventricular function should not be prescribed or should not be taken calcium channel blockers. If their left ventricular function is normal, right ventricular function as well as left ventricular function is normal, they can be given safely calcium channel blockers. We can stop or we can reduce the calcium channel blocker in case of they develop leg swelling or pedal edema. That's very important. Then third, hypertensive drugs, ACE inhibitors. ACE inhibitors, it will have morbidity and mortality benefit, particularly in diabetes and kidney failure patients. ACE inhibitor molecules are enalapril, ramipril, captopril, perindopril, so pril molecules, ACE inhibitors. The side effect of ACE inhibitors are cough, angioedema. With any group of ACE inhibitor, 15 to 20% common with the cough, dry cough, and angioedema less than 5%. Even after prescribing ACE inhibitor, the patient develops cough, we have to stop ACE inhibitor. That's very important. Because why we have to stop it? The patient comfortness is very important. And ACE inhibitor will have heart remodeling functions. That's a very important. Those who are having left ventricular dysfunction, impairment of left ventricular function, the ACE inhibitors significantly improves their ejection fraction and improve their functional capacity. That's a very important. That is the reason this is a gold standard treatment for congestive heart failure, provided the tolerance level is very important. The patient tolerability, we have to look into that point. If they are not tolerating ACE inhibitor, I have to stop prescribing ACE inhibitor to congestive heart failure patients. The next, ARB, angiotensin receptor blockers. Angiotensin receptor blockers are very important. They're equally important. Angiotensin receptor blockers will not have cough unlike ACE inhibitor. We can give angiotensin receptor blocker. The first line, first generation ACE inhibitor, ARB, losartan, then candesartan, telmisartan, irbesartan, azilsartan. The latest to ARB is azilsartan. ARB can be safely prescribed to all the patients, hypertensive patients, diabetes with hypertension, diabetes with a kidney failure patient. Safely we can give ARB, angiotensin receptor blockers. The compulsive contraindication For prescribing ACE inhibitor or ARB is renal artery stenosis very important. In renal artery stenosis, you cannot prescribe ACE inhibitor or ARB. In those cases, safely beta blockers and calcium channel blockers can be prescribed. That's a very important point. The next antihypertensive group, diuretics. Diuretics play a very important role in controlling hypertension. Diuretics, we have three types of diuretics. Thiazide diuretics, number 1. Number 2, loop diuretics. Number 3, potassium sparing diuretics. Thiazide diuretics, especially chlorthalidone, hydrochlorothiazide. These drugs can be prescribed safely to all the patients except gouty arthritis. Gouty arthritis, increased level of uric acid. If you prescribe thiazide diuretics, chlorthalidone, hydrochlorothiazide, that will aggravate the symptom of gouty arthritis. That's the only complication. We need to be careful. And in elderly population, middle-aged to elderly people, prescribing thiazide diuretics will have impairment in potassium level. So any patient, those who are having diuretics, we need to be careful. Periodically, we have to check their serum electrolytes level, especially sodium, potassium. That's a very important molecule. Low level sodium can cause syncope and coma. Low level potassium in the blood can cause arrhythmia. At the same time, increased level of potassium can cause cardiac arrhythmia. That's a very important. And increased level of potassium also will damage the kidney. So, hypokalemia, low level potassium. Hyperkalemia, high level potassium. These should be monitored and properly taken care during diuretics treatment. And loop diuretics, the very important diuretics in the management of congestive heart failure and pulmonary edema. Very important drugs, life-saving drugs. Loop diuretics are furosemide, torsemide. It's a very important molecule. This can be safely prescribed to all the patients. There is no restriction. Particularly, this can be given only to congestive heart failure patient and renal failure patient, those who are having accelerated hypertension, those who are not tolerating thiazide diuretics and potassium sparing diuretics, and those who are having persistent hyperkalemia. In these patients, safely we can prescribe loop diuretics. Loop diuretics, very common side effect is hypokalemia and hyponatremia. Hyponatremia, low level sodium, low level potassium should be taken care. As I said before, low level sodium will have cerebral coma or giddiness. Low level potassium will cause cardiac arrhythmia. That's very important. Then potassium sparing diuretics. Eplerenone, spironolactone. These are all potassium sparing diuretics. This can be prescribed safely to control the hypertension. The problem with the potassium sparing diuretics, that will increase the potassium level in the blood. That's very important. Sometimes safely we can add potassium sparing diuretics as well as loop diuretics under the expert guidance. Very important. Moreover, loop diuretics and thiazide diuretics should not be prescribed. For example, chlorthalidone, torsemide, hydrochlorothiazide or furosemide. That combination is a very risky combination. As I said before, that will have severe hyponatremia and hypokalemia. That's very important. So medications are very important. And in addition to that, we have other hypertensive drugs, alpha blockers, centrally acting drugs, particularly methyl-dopa, clonidine, and nitrates. We have vasodilating nitrates. These are all the hypertensive drugs. Based on that patient conditions, we select the drugs. Thank you very much for watching Live to Ipcot Cardiac Channel, Cardiac Center channel, Ipcot TV. Once again, thank you all. Subscribe our channel and subscribe this video. And any questions, we will chat in that live chat YouTube channel. Thank you very much. Don't forget to subscribe YouTube. Thank you.